Hello, and thank you for joining us for the Atopic Dermatitis pre-work webinar, Understanding Healthcare Disparities and Health Equity in Atopic Dermatitis Patients, Building Knowledge, Confidence, and Change in Primary Care Providers. I am Brooke Powell. I am Program Manager for Ohio AAP, and I am joined today by Dr. Chris Pelletier, medical expert for this program. For this pre-work webinar today, we are going to go over the aims and highlights of Wave 1, project overview for this wave, data tools and project materials, a little bit about data submission, getting started, a look at PDSAs, implementation, and next steps for the program. Dr. Pelletier.
Thanks, Brooke. As Brooke said, my name's Dr. Chris Pelletier. I'm a primary care pediatrician in Cincinnati in independent practice, and I'm also president of the Ohio chapter. And I have the honor of serving as the primary care expert for this project. I also was the primary care expert for the previous wave, Wave 1. So wanted to give you just a little bit of a brief overview of work that we did back in Wave 1. And this was, the title was Atopic Dermatitis, Building a System of Care. And our global aim was to improve knowledge and ability of providers to manage atopic dermatitis with patients in a primary care setting. And this included increasing the delivery of educational resources to families, addressing emotional and behavioral aspects of atopic dermatitis, and ensuring proper treatment adherence. Our specific aims were from July 2020 through June of 2021. The practices will work to improve proper recognition and diagnosis of atopic dermatitis in their pediatric patients, improve delivery of anticipatory guidance, and assist families in adhering to suggested treatment strategies to decrease referrals to dermatologists for mild cases. Next slide, Brooke. So how do we do? Here's some highlights from that Wave 1 of our project. In terms of providing resources, at baseline, very few providers, 10% were using resources that they had prior to the beginning of the project that they were sharing with families. Midway through the project at 2021, providers in the collaborative reached 71% use of resources, which was the highest during the project. And that pretty much sustained right around that mark throughout the remainder of the project. In terms of a atopic dermatitis action plan, our team actually created a atopic dermatitis action plan, and we shared that with the practices. And at the end of the project, action plans were used in 62% of the visits for children that presented with a diagnosis of atopic dermatitis. One of the really unique aspects of this program was that not only did we obviously focus on the medical diagnosis and management of atopic dermatitis, but we really looked at how atopic dermatitis can affect behavioral, psychosocial aspects of patients and families. And we introduced a atopic dermatitis quality of life scale that was used during the project. Looking at our measure for increasing in provider confidence in both diagnosing and managing atopic dermatitis, at the end of the project, all of the practice leaders reported that they were very confident in discussing atopic dermatitis and resources, which was an 85% increase from the beginning of the project. And then finally, we looked at referrals. Referrals to a specialist did actually increase from 2% to 6%. And that was the one measure that we really, did not, see what we expected. However, the number of patients referred to a pediatric dermatologist did remain very low and was under 10% during the project. Next slide, Brooke. So when we were looking at, the next iteration of this project, or Wave 2, the biggest thing that we really wanted to look at was, applying the knowledge that we learned from Wave 1 and diagnosing and managing patients with atopic dermatitis, but specifically looking at diversity, healthcare disparities, and health equity. And so I'm going to turn it over to Brooke to sort of go through the project for this second wave in a bit more detail. Brooke?
Thank you, Dr. Pelletier. Starting with the AD program team, you are hearing Chris and I talk today, but our expanded team includes Dr. Esteban Fernandez-Faith. He's our medical director for this wave. He comes from Nationwide Children's Hospital. Dr. Patricia Treadwell, our dermatology expert from Indiana University School of Medicine. We have the pleasure of working with Zainab, our data analyst from the Ohio Department of Health. And then my contact for this wave of the program as program manager will be for this wave. Global aim for wave 2, as Dr. Chris said, we have a new diversity and equity and inclusion focus for wave 2. We want to increase knowledge, confidence, and competence of healthcare providers in recognizing and discussing symptoms of AD, treatment options, and overall care management of pediatric patients with an AD diagnosis, especially in patients with skin of color. Specific aims include increased provider confidence at diagnosing AD and making appropriate referrals to a dermatologist as needed, improve delivery of culturally appropriate anticipatory guidance, assist families and caregivers in adhering to suggested treatment strategies, make appropriate referrals to dermatology for mild to moderate cases, increase diagnostic AD screenings among patients of color, and also increase quality of life screenings among patients of color. I always call key driver diagrams kind of a fancy way to put our goals and aims into place. What key drivers will be used to get those goals and aims active, and then what interventions are the program participants doing during the program. So this, you don't need to worry too much about it as a participant, but it is something that we keep in the file and take a look at every once in a while. Project methods include incorporate AD screenings for all patients birth to 18 years old who present with symptoms of AD. Provide discussion using evidence-based talking points. We will talk a little bit about those later, a little bit more. Provide resources to all patients and caregivers with diagnosis and/or symptoms of AD. Use QI principles to ensure screening, discussion, and resource provision occur consistently. Incorporate quality of life screening for all patients birth to 18 years old who present with symptoms of AD. And increase knowledge and utilize tools for accurate assessment, diagnosis, including AD severity, especially in diverse populations. Within this program, we will have a participant website. It is currently under construction, but this will be the web address. You weren't sent this in your documentation that came last week. This will be the web address. I will send out what the password is going to be once everything is done. We are going to include on the website recordings of this program, things like this, the webinar, the action period calls for review later if you can't make it to the live virtual sessions. The eczema action plan will be on there, links to data collection forms, talking points, AD resources, RAT cards, PDSA worksheets for an example. So that'll be kind of your go-to for the program and the resources. Also unique approach for this wave, we had a focus group done in the middle of October. We were able to get 10 participants, including patients and caregivers, to look at our current program resources and make suggestions on their effectiveness in communicating to specifically participants with skin of color. So we had a diverse focus for the focus group, including the races that you see there. Like I said, we had 10 participants. Everybody showed up, and we are working on getting the final report, and more information will come out on that. And we will make the appropriate updates to the program materials before the participants see them. And Dr. Chris.
So I'm going to talk a little bit just in generalities about some of the AD resources that you're going to have access to through this program. During our kickoff call and our action period calls, we will sort of dive into these in a little bit more detail. But all of these we created and used during our first wave. And as Brooke said, we've tweaked them a little bit, specifically trying to be more intentional about focusing on diverse populations, including children of skin of color. And the focus groups that were held last month were really vital in helping us really sort of hone these resources. So just some examples of some resources that you have access to through this project. We have rack cards for both caregivers and patients that are really nice for you to hand out in your office and have some talking points about things to consider, management tips for atopic dermatitis. And so those were really well received during wave one. Obviously, throughout this, we're going to be both myself as a primary care pediatrician and both of our other physician leads are pediatric dermatologists. And so really will give you lots of talking points to sort of talk with your families about managing atopic dermatitis and specifically looking at unique things for diverse populations, as well as focusing on some psychosocial aspects. One of our action period calls is going to feature a pediatric psychiatrist that worked with us on wave one, sort of really helping you deal with some of the behavioral aspects of atopic dermatitis. One of the really nice things is that we were able to share various templates within our EHRs. Obviously, many of us will use different EHRs. For those of you that are on Epic, there was a lot of Epic sharing in wave one. I'm on a smaller platform. I use Physician Computer Company, but was able to create a atopic dermatitis specific template, which although I have a different EHR, I'm happy to sort of share a PDF copy of that. Really, we were able to take we'll talk about data collection in a few minutes, but really was able to take sort of that data collection tool and basically just put it into an EHR template so that when we were doing data collection, it was very easy to collect that data. I mean, we didn't have to go searching for it. Of course, I've mentioned the eczema action plan, which I think of all of the successes of wave one, that was probably the thing that I was most proud of, and I think the tool that we used the most. It's very similar to, we modeled it on the asthma action plan, and when we talk about management, we had sort of the green zone, yellow zone, red zone, what to do as far as moisturizers, topical steroids, other medications, when to seek care with your primary care provider. So we will, of course, be sharing that, and we'll encourage you to use that throughout your visits. And then again, this wave, we're going to be using some quality of life surveys that we did not create. They are actually have been developed by other researchers, and they have been validated, and we will introduce those throughout the project as well. Next slide, Brooke. Another resource that I would highly recommend that you utilize as you're sort of getting ready to dive into this project are two podcasts that we recorded, Atopic Dermatitis, Improving Care in Diverse Populations. And it was really more of a conversational podcast. It was not a webinar. There were no slides, but I had the pleasure of moderating with our two pediatric dermatologists, Dr. Fernandez Faith and Dr. Treadwell. And we covered over the course of about two podcasts, which I think in total lasted probably about 50 minutes or so. Background in epidemiology, we looked at how presentation of atopic dermatitis can differ in children with skin of color. We looked at some different cultural preferences and practices, especially when it comes to management. We looked at some of the comorbidities, and we briefly touched on some of the psychosocial impacts of atopic dermatitis. We looked at treatment and how health disparities and access to care and access to medications can affect that. And then we also talked about some of the hot topics and some of the newer medications that the pediatric dermatologists have at their disposal. And so there is a link to that. You can go to our website, ohioaap.org, and search for those. Again, really, we're going to do a little bit of a primer on atopic dermatitis and management and diagnosis at our kickoff call. But I would highly recommend that you as you're driving to work or out walking, listen to those podcasts. And I'm going to turn it back over to Brooke.
Thank you. Yeah, those podcasts turned out well. They are a great resource. So we will probably continue to reference those throughout the program. As Dr. Pelletier mentioned, we will be having a kickoff call So your next step after watching this pre-work webinar is to schedule your kickoff call, in quotes, with me to go over any questions you have about the program. These are going to be about 30 minutes or as much time that you need to get all of your questions answered and feel comfortable about starting the program. These will be scheduled by you based on your availability, so I am happy to work with you on that. These can be a traditional phone call, or we can set up a Teams or Zoom call so we can have video. Also part of all the good stuff happening before you start a program includes the pre-work survey. So this survey will be completed before the program starts, and then you'll see the same link at the end of the program. We just want to get a good idea of where participants are starting and then where they're ending. The information gathered is going to be about your practice, your experience with QI, and your confidence in AD-related items. It is about 30 questions, so allow a little bit of time to take this, but we please ask that you answer the questions honestly. Don't feel bad about any of the answers that you have to provide, because you are just starting the program and you might have limited knowledge about AD and how it is implemented in your practice. So please know that your answers will stay within the program team and only be used to measure how much you are learning throughout the program, which is a good thing. And then the pre-work survey link was emailed to you, but I can certainly get it to you again. Also, part of the beginning of a program, the fun stuff is the baseline data collection. Just like the pre-work survey, we want to capture how you are at baseline or at the beginning of the program, simply to compare what improvements were made throughout the program. So for baseline for this wave of the AD-QI program, we are asking you to do 10 chart reviews, or a chart review on every patient if it is less than 10 patients per month per provider participating in the program. The charts will be pulled at random for visits during November 2021 and April of 2022. We want to echo the current timeline of this wave of the program, so baseline can more align with today and the seasonality. Patients with the current diagnosis of AD is important for chart reviews here. Baseline data survey link will be emailed to you when it is all set and ready. And we ask that baseline is due by December 15th of this year. Okay, so to conclude the conversation on baseline data survey and the data collection survey are going to be the same survey link. But we are going to call what data we are collecting something different depending on the point in the program. Don't be confused by this. Just think about it in terms of baseline data, kind of at anything before December 31st. And then QI data or non-baseline data will be collected after December 31st. So the official point at which we start data collection for the program. Yeah, don't be confused that the survey links are the same. We are just, that's how we are collecting data for this wave. So we talked a little bit about this. Data collected after December 31st of this year will be considered non-baseline data or QI data for the program. And then if you are running behind, of course, because of the holidays and everything going on, if any baseline data, so the chart review piece that is submitted after December 31st, just email me so we can adjust that. Chris?
So I'm going to talk a very brief overview of quality improvement model. And so here at the Ohio AAP, the model that we use, and I'm sure most of you are familiar with this, is the PDSA cycle or Plan, Do, Study, Act. And really, when you're using this model for improvement, you know, it's really nice because it walks you through step by step sort of how to improve the care that you give in your practice. So the first question is always, what are we trying to accomplish? What do we want to do? And then you have to ask, well, how am I going to know that a change is an improvement? So how is it going to impact the care that we deliver? And then what change can we make that will result in that improvement? Next slide, Brooke. So throughout this project, we are asking that you complete 3 Plan, Do, Study, Act cycles. And, you know, we sort of space those out. So the first one will be due in January, the second in April, and the third in June. And just going to give you some examples of some of the things that we did in wave one, different practices. So it could be implementing screening. My practice when we did wave one, our very first PDSA cycle was really creating, incorporating, and having providers use the atopic dermatitis protocol in our EHR. Prior to starting this project, we just had a very generic rash protocol, and we created a very specific atopic dermatitis protocol that, like I said, really captured all of the requirements for the data collection. So it was very easy. Not only did it improve sort of in helping diagnose atopic dermatitis, but document its management, and then it was very useful when we went to do data collection. Obviously, you could choose to, do a PDSA cycle, and how are you going to implement the eczema action plan? Looking at providing resources to patient and caregivers. Obviously, maybe you feel that your practice is good at sort of diagnosing, but maybe not so good at follow-up. So maybe one of the things that you want to do to improve your care is having more frequent in-person follow-up with your atopic dermatitis patients. And it's really, involve your entire staff, right? This not only involves the providers, but also your back office clinical staff. It obviously can involve your front office staff. So really the sky's the limit. You're really just looking at how can my practice improve the care of children with atopic dermatitis. And then on the next slide, I'm going to show you, but the chapter will provide you with PDSA cycle worksheets that really, it's sort of a map that really will help you sort of how to do a PDSA cycle, especially if you've never done one before. Next slide, Brooke. And this is just an example of that worksheet. And again, you really just kind of work through it. So, you have some things at the top there, the date of when you started, when you implemented, the date of completion, what really are you trying to improve? And it walks you through asking those questions, right? So how will you know that the change is an improvement? And it might be, I'm going to say that 80% of visits with a diagnosis of atopic dermatitis are going to be charted using the atopic dermatitis protocol. That could be how you know that change is an improvement, considering your baseline is you only have 10% of your providers at the time using that protocol. Looking back at the key driver diagram that Brooke showed earlier in the webinar, and what specific key driver does that change impact? And then what do you predict will happen, right? And this is very much like doing an experiment in your high school biology or chemistry class. You have a hypothesis. Sometimes that hypothesis is correct. Often it's not. And that's really the beauty of this. Is a continuous cycle. So, at the end of, the 2-week period, let's say that you're going to do this test of change, you look at, did the cycle get carried out as planned? Yes or no? Sometimes things happen that, because of other issues, maybe it's the fact that we are, having the busiest fall that we've had probably since H1N1, that really your office didn't have the time or resources to implement that. And that happens. And then looking at what were the results. Did the results match your prediction? Did 80% of the time, those providers, when they saw a child with atopic dermatitis, did they use the atopic dermatitis protocol? And then this is really, I think, the key step at looking at ACT. This is the 4th step. And you really are going to go in one of 3 directions. If, for instance, it was not nothing changed, or it was not what you expected, you may decide to abandon it. You may have to say, you know what, this just doesn't work for our practice and we need to look at something else. You may decide to adopt it. It may have gone exactly the way you thought it was going to be. And you're like, this is what we're going to do from now on. We're going to incorporate this into our workflow. More often, it's probably that middle option where you're going to adapt. Some things worked, some things didn't. You tweak it, and then you actually can do another PDSA cycle based on the changes that you made to that plan. So that is an overview of the PDSA cycle worksheet. And again, during some of the action period calls, we'll sort of talk more in depth about these and have you share some of your PDSA cycle ideas. We can have a idea generating session. And then as the project goes on, it's always great to sort of hear how things are going. Next slide, Brooke.
Can I quickly add on the worksheets? If you have
Please.
a thanks PDSA worksheet that you are currently using that you are comfortable with, please feel free to use that. This is just an example of something that is available, and ours is typable. You can type right on the form. Feel free to use your own, or feel free to write down in pen and scan it in and fax it in too.
Perfect. And this, it's totally up to you. We as a team, this is not an assignment that gets graded, right? We are not going to approve your PDSA cycle. This is for you. This is what you feel like is best for your practice. So we are here to help guide you and to give suggestions and encouragement. As our peers, we all learn from each other. But this is really what's best for your practice. I just wanted to kind of talk a little bit about office flow and some of the lessons I learned from wave one. So, I'm really going to talk about data collection and how that works practically in the office. So what we did is, number one was educating our providers that when you're seeing a patient with atopic dermatitis that you're managing in the office, making sure that at least for our practice that they use a list of specific diagnosis, be it atopic dermatitis, eczema, and having a list of and building those into your protocol, right? So in my atopic dermatitis protocol, we had a menu of diagnoses that they could just check. So they didn't even have to search for it. It was there. And the reason that that is important is because at the beginning of each month, you're going to need to identify the patients that were seen in your practice with a diagnosis of atopic dermatitis. So again, that's a possibility for a PDSA cycle, right? Actually using the diagnosis of atopic dermatitis when a patient is seen with atopic dermatitis, because that was the way that we were able to identify charts and do an EHR report so that then we could go back and do our data collection. So data collection frequency is once a month, and essentially what I had my office manager do was she would run a report for the previous month with all of our providers that used one of those diagnoses for atopic dermatitis or eczema. She would then give me that list, and then I would essentially just do a chart review. And I would have the project data collection tool, which was a web-based tool. It was very simple, takes about a minute per chart, if even that. And again, I set our template up sort of based on that data collection tool. So as I'm going down, I could just say, what were the symptoms that this child presented with? Was a diagnosis made? What treatment options were discussed? Was there a referral made? So it made that very easy. And I think that made the data collection very, very easy. And again, you're going to be doing that once a month. Usually we say during the first week of the month. And like any quality improvement project, this is truly a team effort. It definitely takes a champion, and you, by sort of being the point person in your practice, sort of are the de facto champion for this project. But it involves the providers. It involves your back office staff, being able to, know where the eczema action plans are when you need them, or the quality of life surveys. It involves your front office, being able to run a recall list for patients that were seen with atopic dermatitis in the last 3 months that you want them to call and schedule for follow-up visits. So, having, updates for the entire practice is really important. Next slide, Brooke. And I'm going to turn it over to Brooke to talk about more specifics of implementation.
Thank you. You should have seen this before, emailed out last week, but all of our projects have a timeline just to keep everything straight. Now, I do want to say that it is subject to change, but it gives you kind of a good idea of what the timeline of the program is going to look like, especially at the beginning when so many things are happening. So we broke it down with the monthly activities, the due dates of the data, PDSA cycles, some ideas for PDSAs, and tracking your practice goals. This was emailed to you, and this is what the timeline looks like. This is kind of a snapshot of the top of it. It does have the survey links in there, but if you misplaced that or you need it again, please don't hesitate to reach out. We talked a little bit about this, but it's worth repeating. Data collection requirements. Each team will submit the data using the data collection tool link. The link is in the recruitment packet that was emailed to you, but it'll also be available online or from me at any time. The data will be calculated within the first week of the month by our data analyst, Zainab, following the collection. So it's going to be kind of a trickle in process with the data, but we are going to kind of pull the data down once a month and take a look at that. And then we will talk about the aggregate data on the action period calls, and the individual data needs that you need will be discussed. And what your individual data looks like will be discussed on the practice coaching calls that are going to be happening every other month. But first, let's talk about the action period calls. So these are going to be like the educational sessions for the program. This is the fun stuff. This is where we get speakers in there, and this is where we talk about the important topics. We will be polling you for ideas on what you want to see throughout the program during the action period calls. We do have some good ideas on tap, but we want to hear from you also. So these will be held every other month. They'll be about an hour. They'll all be virtual via Zoom. Depending on the timing of everything, your entire team's encouraged to attend. So providers and staff and support. Anyone who wants to learn about AD or QI, very welcome to join. But at least one member of the team must join as a representative. Calls are recorded and will be posted for reference and sharing if you are unavailable to make it. We will just have the communication that you did watch them so you can get credit. They will be held during the following months. So we'll kick off in January, March, May, July, and September. All the calls will be virtual. You will get an invitation from me as a calendar in your email. And for the first action period call, if you could please bring your ideas for what items you would like to see on the AD provider points that are still being created. But we want to make sure that we are including things that you would find helpful to talk to patients and families about AD in your office. So the every other month will be the action period calls, and then the month that there is not an action period call, they will be a practice coaching call. So those will be when you schedule your kickoff call with me in November, and bring your questions, please, about the program. And then February, April, June, and August will be the others. Again, we will go over your individual data, answer any questions that you have, talk about your PDSA, how those are going. These will be scheduled around your availability. The program champion can attend these, or the staff can attend and share the information. But it is simple as emailing me, and we can schedule a phone call or a Zoom call, whatever you are comfortable with, and talk about your data. So this is the good stuff. You guys want to help your patients and families, but you also, it's important that you get credit for the work that you're doing. So the physician leader within the practice will need to attest for each physician's meaningful participation in the program. To receive credit, the practice team must complete the majority of the work that we're being asked to do throughout the program. So the examples in this case are completing the 3 PDSA cycle worksheets, scheduling and attending 3 practice coaching calls with me, attending the majority 4 out of 5 action period calls, and for each participating provider, submit data for at least 10 patients per month, or for all the data seen for the AD patients if it is not 10. And for all of that hard work, you will get 25 points of Part 4 MOC. So for next steps, if you could, after reviewing this, please email me to schedule your November kickoff call. This, again, will just be a session with us, about a half an hour or however much time you need to answer all of your questions and get you to a good place for you to start the program. And then next week is our virtual learning session. We will get more clinical on this call, talk about AD and dive deep with that. So that's next Tuesday, November 15th at 7 a.m. If you could please complete your pre-work and baseline data surveys by December 15th. There are holidays, there's a lot going on. We wanted to give you ample time to do this. So hopefully that's enough time. If you need additional time, please just let me know. And that goes for anything throughout the program. If you need a flexible timeline, we can work together. And then if you could begin the data collection tool testing during the month of December, kind of get familiar with what you will be collecting from the charts from the AD patients that you see in your office, and get to a good place before we start in January. And you have heard my name a lot throughout this, but I will be your contact throughout the program. I have access to the good experts on our team. So you have data questions, you have medical questions, you need clinical support, anything that comes up, I am your contact. Email is the best way to get a hold of me. You have my email there. So I'm your program manager throughout this. And again, if you could bring questions that you have about the program on the program kickoff call, that would be helpful. Chris, any other thoughts?
No, I'm just looking forward to wave 2. I'm really glad you guys have decided to take part of this project. Well, I learned a ton in wave 1. Really looking forward to learning more with all of you, and we're looking forward to seeing you on November 15th.